Your patient's 65 years old, has difficulty breathing. You put them on the oxygen. They're not responding to the oxygen. You don't know whether it's pulmonary edema or pneumonia. Stay tuned to this video. I'm going to tell you what to look out for, exactly what to see in your patient so you can know what is the best treatment and how to help them and how to save their life. So stay tuned. I got you. With common critical ALS patients, you better make the right decision with the little bit of time and the little bit of information that you have, because if you make the wrong decision, you may just end up making things worse for your patient. There's always this standard approach, which is give the person oxygen, make sure you have oxygen. When you have ALS capabilities, then go ahead and start a line, get IV access in case you got to give Lasix and things along those lines. If they get so unstable, then go ahead and open up your intubation kit and intubate your patient. But after you intubate your patient, you may also need to BVM your patient and bag them, or something a little less invasive than all that is just put them on the gold standard CPAP treatment if they are able to deal with it, if they're alert and oriented and they're able to meet the criteria for CPAP treatment. And the reason why I want to make this video is because this topic actually hits very close to home. I have a cousin who unfortunately passed away from pneumonia, and I've had one too many patients with pulmonary edema, and sometimes these symptoms may be able to overlap for the person that doesn't have much experience, and I just want to help you so you won't have that issue. My cousin was 33 years old. He had a common cold. His name was Giovanni Molina. May he rest in peace. The guy was my age. We played together in the sandbox and shared each other's toys. And at 33 years old, he caught a cold. That cold led to a pneumonia. Pneumonia led to sepsis, and that sepsis led to cardiac arrest. At 33 years old, he passed away. And I just want to explain to you the difference between pneumonia and pulmonary edema so that you won't have any doubts on which is which and how to treat each one. Now, at the end of this video, I'm going to give you a link to how to treat pulmonary edema step by step. But the main focus here is the differences and also how to treat each one. But the step-by-step in-depth video to how to treat pulmonary edema will be at the end of this video. Small clues in the patient's presentation lead to very big life threats. So the first thing you need to do is ask questions. What you'll see is after doing the patient assessment from the pulmonary edema, a lot of these patients will say it's a sudden onset. A lot of these patients will say that just a little while ago, they were just fine, versus pneumonia. When you have somebody in pneumonia, they'll say that it's a gradual onset. It started off with a cold. It started off with fatigue. It started off with headaches and them not feeling well. So a person with pulmonary edema, a person with pneumonia, they have a few things in common. You may hear crackles on both lung sounds. You may see hypoxemia or hypoxia when you put on the SpO2 monitor on this patient. But I want to also indicate to you what are the differences between these patients. So if we put the person on the SpO2 monitor, right, we're most likely see a oxygen saturation below 90. But there's other things that you can do to discern on what is going on. For example, with pulmonary edema, the cardinal signs of pulmonary edema are just that. Edema of the lower extremities, for example, ascites. They may have a history of congestive heart failure. So when you go ahead and take their blood pressure due to the congestive heart failure, due to the water in their lungs, what you'll see is that they most likely have a very elevated high blood pressure. And also, the higher the sound of crackles within their lung fields, like if it's at the bases, it's not as bad as hearing lung crackles all the way up to the top. So what I want you to identify is that although there's some small similarities between pneumonia and acute pulmonary edema, there's also cardinal signs that will help you identify the difference between each one without a problem. Now, when we talk about pneumonia, when we look at pneumonia, look for tachycardia. Look for a person that is warm or hot to touch. Look for a person that's complaining about recently feeling sick, of a person that has recently had a common cold, that was sneezing, that's been having headaches, that's been immune compromised. So for example, if you have a person who's on prednisone, one of the biggest or one of the most prescribed medications in the world. What every disease in this world has in common is inflammation. That's why prednisone, an anti-inflammatory medication, and things derived or similar to prednisone are prescribed so much, because everyone's trying to decrease the inflammation in a person's body. It's the same inflammation my cousin had. But if you give that person prednisone, then it reduces their immune system, and that's why they're more immune to having immune deficiency type of things like pneumonia, because their system is not responding adequately from leading an unhealthy lifestyle, from being on these medications. My cousin was obese. So what type of information can you get from these patients that'll help you steer down the right path and know what type of treatment to give them? So once we get the patient on the ambulance, you want to start treating them after you find out the difference between each one. So when we talk about pulmonary edema, remember, it's a preload problem. The right side of their heart is most likely failing, and that's why it's all backing up. So what we want to do is get our medications. Make sure you take the person's blood pressure, but get your medications. Look for the nitroglycerin and make sure they meet the indication based on your local protocols to receive nitroglycerin. Then after you give them the nitroglycerin, if they meet the criteria for the CPAP, put them on the CPAP as well. Start an IV and start transporting this patient. And whatever you do, be very careful not to confuse a cardiac wheeze with a regular wheeze, and asthma wheeze, because if you give these people albuterol, you may make things worse instead of making them better. So be very cautious. But when you have pneumonia, what do you want to do for pneumonia? Remember, pneumonia is caused most likely by a bacteria. Pneumonia is most likely caused by some kind of microorganism. That's why they're having the fevers. That's why they're having all these issues. So what they need in the majority of cases is rapid, broad spectrum antibiotics or some kind of antibiotic. So put the person on oxygen, expedite the treatment, because in the pre-hospital care setting, the only thing you could do is provide comfort. For example, if they're hypotensive because of the sepsis and they're in septic shock, for example, you may find this at a nursing home where the person's extremely tachycardic, or you may find that at home from somebody who waited till the last minute to call 911. Either way, take their blood pressure and they're most likely hypotensive, then start an IV and give them fluid based on your local protocols. But also remember, these people need antibiotics as soon as possible. I'm all about preventative medicine. What these people really, really needed was to lead a healthier lifestyle. In the majority of cases, what they needed was not being in the nursing home, because in the nursing home is a germ factory and they got exposed to pneumonia because their neighbor in the room on bed 2 had pneumonia too. And that's now the reason why they have it. There's so many different variables, but I'm just saying to you, some of the most common ones could be avoided if people will proceed with a preventative mindset. But that's not up to you. I'm just giving you a little bit of extra education. That way you can know how to treat your patients, the best, how to be mindful for your family and also be mindful for yourself. A lot of times not leading a healthy lifestyle makes you immune compromised, like I mentioned before. But nonetheless, they need antibiotics, and hopefully you get them sooner than later. That way you will avoid the propagation of these antibiotics. And even if you start them sooner than later, if a person has so many comorbidities, like my cousin, he was diabetic. Yeah, he was 33 years old, but he was obese. He was diabetic as well. And unfortunately, even though he had the antibiotics on board, they weren't as effective because of all the other things that he had working against him. Pneumonia doesn't care who you are. In the majority of cases, pulmonary edema attacks people with heart problems, and these tend to be adults. But pneumonia can happen to anybody at any age. So please, I keep mentioning the healthy lifestyle because you're prone to having this. Like, this could happen to anybody, and no one's immune to it. And if you're an emergency care worker, if you're an emergency worker and you're transporting people, if you're treating people under these circumstances where if you're not leading a healthy lifestyle, you could potentially cause the common cold that leads to pneumonia, and that pneumonia leads to sepsis. So I just want to encourage you and remind you, diseases do not discriminate. They don't care whether you're on the right side or the left side of politics. They don't care what your skin color is. So I keep mentioning my cousin because I want you to wake up as well, and I don't want you to be affected by this. Remember, pneumonia and diseases that we treat our patients with, they don't discriminate. You can catch them too. So please, my people, Another determining factor between the difference between pneumonia and pulmonary edema, it doesn't matter who you are, you can catch both. But in the majority of cases, you'll see pulmonary edema in people that are elderly and people that have heart problems and people that have these type of issues. But pneumonia, anybody could catch it. So let's recap real quick. Pulmonary edema is wet. Pneumonia is sick. If you have someone with pulmonary edema, they're going to be hypertensive. They're going to have a sudden onset. They're going to need CPAP and nitroglycerin, and they're going to most likely have other healthcare problems or health chronic diseases related to their heart. And most likely, it's heart failure in the majority of cases. When we talk about pneumonia, the person's going to be sick. It's going to be a gradual onset where they started off with a cold, they started off with a flu, and that flu led to other things. And now they need an x-ray to confirm the presence of this pneumonia. But most likely on the signs and symptoms, you could start steering towards that direction, because when you touch them, they're hot to touch, they're warm to touch, they're tachycardic. And if it's really, really advanced, then they'll be hypotensive. And then you give them fluids, you give them oxygen, and you put them on a rapid transport type of call, which is code 1 or code 3, depending on where you're working as a first responder. But these are the main key differences between both of them. And the treatment for pneumonia, once you drop them off at the hospital, once again, don't forget, they're going to need antibiotics. So expedite the transport to the hospital. So rest in peace to my cousin, my brother, Giovanni Molina. I love you, bro. I hope you're with Jesus Christ right now. And my people, I made this video and I'm going to make more resources. And part of the proceeds from what I'm about to introduce to you are going to go to Giovanni's mother. And also, what I want to introduce to you is this. I'm thinking about creating a resource that you are not able to find in the EMT or paramedic classroom, a resource that you won't find in the textbook, a resource that will teach you how to be a better paramedic, how to be a better EMT before your shift, during your shift, and after your shift. I want to teach you guys how to be more clinically sound. And what allows me to speak about this, guys, I've been in healthcare for over 20 years. And although I'm a paramedic, I have a doctorate degree in medicine. I'm a medical doctor, and I'm getting ready to start working in the emergency room as a doctor. And right now I'm on the ambulance and I'm wearing the boots that you wear. We share the same experience with the same patients, from the nursing homes to the 911 calls. And I want to share with you everything that I learned in all these 20 plus years. And I want to share with you within a video series that'll speed up and help you shake off that rookie feeling, that feeling of not knowing what to do or when to do it. I want to help you with it. I want to help you feel more confident when treating patients. I want to help you feel more confident with the reality that you have people's lives in your hands. And that's why I want to create this video series for you. It's going to be off of YouTube, and it's going to be through a paid wall where basically you pay your one-time fee. And then after you have the one-time fee, you'll have lifetime access. And that's only for the first 100 people that purchase it. This is the founders access. I've uploaded almost 600 videos in this YouTube channel, and I hear a lot of people in person, through the comments, through Instagram. They tell me how much these videos are helping them, and I want to continue helping them. And I want to continue helping them with a resource, a very extensive resource that boils down all my 20 plus years of experience in a digital format. And that's why I want to create, once again, the Founders Special, where the first 100 people will have lifetime access. And this is what it will include. It's going to include over 100 lessons that I wish I would have learned in my first year working as a healthcare provider. It's going to include my everyday carry checklist. I'm going to share with you guys how to stay resilient, how to not get phased by pediatric cardiac arrest, and what to do when you're on a pediatric cardiac arrest, how to save people in the worst of scenarios. Guys, remember, I have over 20 years of healthcare experience, and most of which came from the Bronx, New York City, the busiest 911 system in the world. And I want to share with you. And at the price that I'm going to share with you, it's going to be $59 early bird pre-sale special. It'll be $100 afterwards. But if you want to support the channel, if you want to help me support Giovanni's mother, and also there's a money back guarantee. So if after 14 days after the launch you're not satisfied with what you receive, then it's totally fine, and I'll return you your money, no questions asked. All right, my people. So once again, I hope this helps, and I'm here for you. Peace.